Hello and welcome to the next webinar as part of this Your Health, Your Wellbeing and Your Numbers series. And today I'm going to be talking about smoking, the myths around what helps and what is hype. And these webinars have been put together by myself, Helen Donovan, and my colleague Lola Kahendi, and we're both associates in nursing at C3 Collaborative. Um, and C3 Collaborating for Health is a global charity with an aim of creating a world where nobody dies from preventable chronic diseases, sometimes referred to as non-communicable diseases, things like cardiovascular disease, so heart disease, strokes, things like that. Smoking obviously adds to those risks. Also, things like respiratory illnesses and things like diabetes, and many cancers fall into this category of non-communicable disease. Now, there's a lot of noise out there in the system, shall we say, and some facts, but a lot of myths as well. So one of the pieces of work, one of this is about trying to support people to navigate what's good and what's bad. What are the useful bits of information and what's maybe some of the not so useful bits of information. And one of the ways that we're recommending is that you look at for this. This is the Patient Information Forum PIFTIC. So it looks like that, Trusted Information Creator. And it means that it's gone through a process. It's been produced by an organisation that's got some credibility to it. But look for yourself. Is there a date on it? So is it current information or is it old? Where does it come from? Who's producing it? Does it look professional? Is it actually trying to sell you something? And obviously be very cautious of that because you probably don't need to buy anything particularly clever or expensive. Does it include sources or references so you can go and look into where the information has come from a bit more? And is it backed by other organizations? So all good things. And think about organizations such as the World Health Organization or the NHS. So today I'm really talking about smoking myths, and we all know that smoking is not good for us, but we also know that smoking can be really hard to quit. It can be really hard to stop smoking. So there's lots of products out there, patches, vapes, and I'm going to touch on some of these that you might be able to use. Can smoking ever be good for you? Well, the answer is no. But when you go back and looking at some of the old adverts, you may be forgiven for thinking, well, there was some confusion over this. This is you've got a dentist recommending cigarettes, doctors who say they smoke certain cigarettes, and even this Mr. Sig visiting a hospital offering out free cigarettes to people. So it's never good. Smoking is always going to be bad for you. It's going to cause age-related hearing loss, rheumatoid arthritis, back and neck pain, psoriasis and other skin problems, particularly wrinkling skin, cataracts and macular degeneration, type 2 diabetes, Crohn's disease, infertility, gum diseases and impotence. So 96,000 deaths in the UK are caused by or attributed to smoking. 80% of deaths from lung cancer, 80% of deaths from chronic obstructive pulmonary disease, that's what that acronym stands for, 17% of deaths from heart disease, and a quarter of all cancer deaths can be attributed to smoking as well. And smokers under the age of 40 have have a 5 times greater risk of a heart attack than somebody who is a non-smoker. Nicotine is highly addictive. Some people have attributed it to being more addictive than things like heroin. And what happens when you puff on a cigarette, you get a rapid hit, a dopamine release, making you feel better. And that's the teaching signal, being a behavior, reinforced behavior, and makes you subsequently more likely to repeat it. So it trains our brains to behave in a certain way. Why is it? Why people might say it's just too hard. It's just too late for me. What's the point? I've been smoking for years. Well, there is a lot of evidence that immediately following quitting, after 20 minutes, your pulse will already have calmed down. Your carbon monoxide levels will be reduced after 48 hours. After 8 hours, your oxygen levels are recovering, and those harmful carbon monoxide levels are beginning to reduce. And as I say, after 48 hours, they'll be back to normal. 72 hours, you'll be noticing your breathing is a bit easier. And after 2 to 12 weeks, your blood will be pumping through your heart muscles much better. So it actually helps reduce your blood pressure. After 3 to 9 months, any coughs and wheezing will improve your lung function. So it is never too late to stop. After a year, your heart attack will have halved compared to a smoker's. So immediately giving you that impact. And after 10 years, your risk of death from lung cancer will again be halved into that compared to a non-smoker. It's never too late. Another myth is that smoking is going to help me manage my stress. Now, I've already said that nicotine does give you a short burst of dopamine, which gives you maybe a calmness and maybe a bit of pleasure, but that is very, very quick. And it actually immediately is triggered withdrawal symptoms, irritability, and anxiety. So learning the need to then smoke again, it's that taught behavior. And withdrawal symptoms can make mistakes for everyday stress and can cause that feeling that, well, if I have a cigarette, I'll feel better. But it's the withdrawal from the cigarettes, from the nicotine. It causes more stress. So it's that cyclical approach, keeps you hooked. Quitting reduces your anxiety, it creates a balance in your life, and it makes people feel stronger in the long run. So it's a myth that it's going to make you feel calm. What is going to help you quit and stay stopped? So we do know that it's really important that you don't try and do it alone. Access smoking support, stop smoking services, adding a nicotine replacement, whatever type you decide to choose. But often using a vape alongside other support gives you twice as much effectiveness in stopping smoking than trying a vape alone. So always do it with support and with that guidance. Now, there's again on the NHS websites, there's information about finding your local stop smoking services, and there's a telephone number here on this slide. NHS Stop Smoking Services will help you quit. Um, and some guidance here for whatever stage you're at. So why quit smoking? Some information there. If you're ready to stop, what you can do, getting the support you need, and then staying smoke free. Learn how to manage those cravings, and downloading the free smoking cessation app will be useful. So what about vapes? There's a lot of stuff been talked about them over the years, and sometimes you might be sort of triggered to think, well, they're no better, and certainly they have their limitations. They have their concerns. Vaping is, though, much less harmful than smoking tobacco, and all of the guidance from the public health agencies and from the NHS is that vaping is going to be better than smoking. Obviously, vaping is not risk-free, and we would want people to eventually come off their vapes as well. And we don't want non-smokers to just start vaping just to give it a go. But even in pregnant women, it's better to vape than to smoke. And I think that's the thing. Don't start vaping. Don't, if you see people who are sort of tempted to give it a go, that's not the answer. But certainly, if you are a smoker, then it's going to be better to vape than not than smoke. All vapes are the same. Well, no, they're not. Some vapes are mass produce, and they don't give you the same information. And do it with the stop smoking services. Make sure that you're using legal and regulated products. Don't get into the habit of using unregulated products. And there's some guidance on this slide. And make sure that you use vapes that have got enough nicotine in for your habit. And remember to dispose of them safely, because they are an environmental and a sustainability challenge in terms of how we get rid of products. People use vapes more frequently than cigarette, and that must be worse. And sometimes you might be thinking, I see people and they've got the vape to their mouth all the time, but it's actually normal to vape more frequently than smoking. Vaping is different, and the advice is that you need to almost sip the vape, because it takes longer for the nicotine to reach the brain, requiring people to do that sort of regular sipping on the vape more frequently. So it's really important that if you have got people who are wanting to vape, that you encourage them to do it as much as they need to stay stopping. Another myth out there is that pregnant women shouldn't vape. Well, that's not true either. There is a lot of evidence that, again, vaping is going to be better than smoking. Obviously, we don't want people to be taking nicotine at all, and it's not risk-free, but it's certainly going to be better than smoking. There are other nicotine replacement treatments, and sometimes these can be used in combination. And there is evidence that using them in combination will improve the likelihood of you stopping and staying quit for longer. So patches, even some tablets. There's some medication now that are able to help retrain the brain, making sure that you reduce the pleasure that you get from smoking cigarettes. So in summary, make a plan, set a date, and that will help your motivation. What are your triggers? Is it sort of at the end of the day as you're coming home from work, or is it first thing in the morning, or is it a combination? What are your triggers? And maybe try and think of something else that you do at those times. Getting help, much better, and we know that people are more likely to achieve their stopping smoking if they get help, and use nicotine replacement, medication, or a combination of those. And looking after yourself, those breathing exercises that we've talked about before, and then give us your feedback. Use the QR code.